So I want to introduce Dr. Aaron Gonshore to all of you. So he is the president and CEO of Fluids IQ, and this is a Canadian laboratory. It's based in Toronto, and it specializes in wellness testing. Dr. Gonshore is a PhD physiologist and maxillofacial reconstructive surgeon. He has published and lectured extensively on stem cell regeneration therapy and PRP-enhanced graft reconstruction. His interest and expertise in the fast-growing area of salivary diagnostics has led him to create Fluids IQ. And this is a company that is specialized in using saliva and other bodily fluids for wellness testing. So we welcome Dr. Gonshore, and I will let you take over now.
Well, thank you very, very much. It's a pleasure to be able to speak to all of you again. I'm sorry for the delay, but we did have to get over some hurdles. Let's move right into it then. We're going to talk tonight and do sort of a whirlwind tour of the whole area of gut physiology, with the whole idea of being able to talk about zonulin, and I'm going to describe what zonulin is for intility, otherwise. And
Aaron,
we're going to ask.
The sound's cutting in and out.
Okay. Can you hear me now?
Yes.
And we're going to ask whether there is a connection. We do know that the gut is a portal to health. And as Hippocrates said many, many years ago, all diseases begin in the gut. And so we're going to be doing an overview of the gastrointestinal system, with particular emphasis on intestinal permeability, looking at zonulin and its effect on the paracellular tight junction. We're going to do a little bit of talking about autoimmune disease, and after that we will discuss some of the intestinal permeability assessments that you can do to test. And we're going to finish off with Lucy Blouin, my colleague who's here, who's going to be talking about some of the nutritional modalities that you can use. When we talk about the gut and some of the areas of tight junctions and so on, we do need to know that there are many non-self antigens, toxins, microorganisms, gluten as a typical example of food particles that can affect the way in which the gut does deal with them. And when things go wrong, you can begin to get a series of problems that can go from nutrient malabsorption right through to food intolerance, inflammation, and of course, eventually to some form of autoimmunity. So today's discussion, or this evening's discussion, will be going through first digestion and absorption, and then moving through some of these other aspects which we're going through in detail. Let's talk a little bit about digestion and absorption. If you take a look at the amount of food that you take in a lifetime, it's somewhere between 30 and 40 tons. So this wonderful organ, the gut, with this one cell layer of cells, of enterocytes, is supposed to be able to negotiate all of these tons of food that come through our system. And we know that a percentage of all individuals, in many cases a great percentage, that are older than 2 years old, do not meet their 100% dietary allowance. And here we're showing you just a number of different percentages that we lack when we're looking at everything from minerals and vitamins and various other foods. And I know that many of you are quite familiar with that. So let's take a look at the digestive tract and get some idea of what's really going on. The digestive system we can look at as a web of control. And it is a web that controls muscular action, the immune system, neurological and endocrine function, cardiovascular, and of course, metabolism. And so if you look at the nutritional principles as you go through the entire area of the gut, one can see that there are a number of different things that are principles, everything from eating, from digesting the food, absorbing that food, then assimilating it, and eventually excreting it in a proper way. In the oral cavity and the esophagus, the issue of mastication and swallowing, we all know very well with the saliva glands and some of the enzymes which they begin to deal with when the food is beginning to come in. So if you were to look at saliva as a primary function in the oral cavity, you're looking at mucin, which protects the epithelium and the air spaces. You are looking at buffering solutions that begin to buffer the ions, the sodium, the phosphates, and so on. Of course, the bicarbonates. Then you have the series of enzymes that hydrolyze the polysaccharides of bacterial membranes and various other enzymes that begin the process of enzymatic action on the food. One of the classic ones being salivary amylase. And of course, the beginning of antibody effect, the IgA, which you have not only in the mouth, in the oral cavity, but of course, as you move through the intestinal layers, you begin to get more IgA as a function. When you get to the stomach has a whole series of functions. One of its majors is to activate pepsinogen to pepsin. That is through hydrolysis, through acid hydrolysis, you are able through hydrochloric acid to begin the process of protein digestion. You're also destroying the beginning of destruction of microbial intruders, and at the same time, the beginning of mineral absorption. And of course, the importance of the pH of the stomach lining is extremely important when you begin to deal with the absorption of these minerals. And one can use as a predicate of a problem that can occur when you're dealing with something called hypochloridria or low hydrochloric acid, which of course is a problem in aging populations where people over 60 and over 80 have tremendous problems with low hydrochloric acid. What I want you to do is to go to the bottom of this slide and to remember that a very large number of people in North America are suffering from the problems of too low hydrogen ion and therefore hydrochloric acid because they use protein pump inhibitors like Zantac and many others, which of course may give you some positive effects, but one of the things that it does do is it causes a lot of destruction of hydrogen ion formation. And because of that, because of the hypochloridria, you get a lot of bacteria that begin to move into the intestine. They overgrow, and that is, of course, classic small intestinal bacterial overgrowth, which is also called SIBO. And the classic dysbiosis, which we're going to discuss in greater detail in a few minutes, which is microbial imbalance. That good to bad bacterial ratio begins to unbalance, and that causes many problems, including the intrusion of candida and other fungal infections, which will move in when that dysbiosis becomes too effective. And of course, mineral deficiencies and B12. We're doing a whirlwind tour. And now, of course, the pancreas's main objective is enzymatic action on the food when it enters into the intestine. And Lucy will go into more discussion of that. I'll just mention to you that there are a tremendous number of diseases which are associated with a lack or a dysfunction of enzymes, and some of them you see on the screen, from chronic pancreatitis right through to pancreatic duct obstruction. Many people suffering not only autoimmune conditions, but Crohn's disease, anemia, which has a very significant pancreatic effect, and of course those with IBS, in which a fully 20% have some degree of pancreatic insufficiency. The intestine. Well, here we start getting into what is really very important for this evening's discussion, the intestine. It is the largest surface by far of the body, 20 meters in length, about 200 square meters in area, about 2 tennis courts wide of area, tremendous amount of surface area. And in there you have this microbiome with about 130 trillion bacteria. To put that in perspective, we have about 10 trillion cells in the human body. So those bacteria represent well over 10 times the amount of cells that we have in our body. So we have to respect the bacteria that are sitting in symbiosis or commensally helping our body. It is in continuous exposure to the environment so that there are dietary antigens, bacterial antigens, which are affecting our body. And this is one of the reasons why one of the largest amount of immune cells actually sits in intimate contact with this one-walled cell layer of the gut. In fact, 70% of all of the lymphatic tissue of the body sits right in the gut. And that's going to become obvious in a few moments. So here we have a picture in various amounts of microscopy of the intestinal microvilli. And you begin to see why you have this tremendous surface area, because these microvilli are tremendous amount of area that can be affected by food. And what is a major function? Absorption. The intestinal mucosa has a very paradoxical role. On the one hand, it wants to absorb nutrients, but while it's absorbing those nutrients, it needs to exclude toxins and many other macromolecules. Bring in the good stuff, exclude the bad stuff. And if there is a mucosal breach, if something happens to that ability for it to be able to exclude, you get malabsorption with a tremendously increased exposure to toxins and antigens. And so a model of malabsorption would be celiac disease, which we'll discuss in greater detail in a few minutes. But I bring it up now because that is the predicate. That is what really tells you how that model works and what happens when there's malabsorption. So those who have true gluten intolerance are going to have a very significant autoimmune phenomenon, which is predicated on IgG and IgA, those two immunoglobulins and their reactions. The prevalence of celiac disease in previous US studies used to say it was 1 in 6,000, but oh no, it's not. In fact, the present US and European studies show it to be closer to 1 in 100 to 300. And in fact, some studies on IBS show that the rate of people with gluten intolerance is up to about 5%, 1 in 20, which is quite dramatic. And the time to diagnosing it is still known to be 11 years. In other words, most people who have some form of celiac disease, about 90% of them are unaware of their disease, or it's misdiagnosed and it's going to show up years later. So it's a major issue. And of course, symptomatic celiac disease is the tip of the proverbial iceberg, because those with intestinal damage, only a small part of them actually are symptomatic. Most of them have silent celiac disease, which will make itself evident when there are certain triggers, which we'll discuss in a little while. But even more insidious, there are people who have latent celiac disease. In other words, their intestine appears normal, but they have the genetic susceptibility for that. They have the DQ2 and DQ8 alleles, which tell you that they are genetically susceptible to celiac disease. Well, I told you about the immune system that sits in intimate contact. Here is a view of a mouse gut lumen with that one-celled layer in red, and then in intimate contact to it, you see that area of blue and white and green, and those are all the immune cells that are in very intimate contact to the gut cells, and that's called the gut-associated lymphoid tissue, also known as GALT. And that lymphoid tissue, also known as the enteric nervous system, has a tremendous amount of nerve endings. In fact, there are more nerve endings in the gastrointestinal tract and the GI tract than there are in the spine. And it controls tremendous number of neurotransmitters. One of the main ones is serotonin. 95% of serotonin is actually made in the gut, not in the brain, but in the gut. And it controls peristalsis, that is the muscular movement in the gut, which moves food along. It is what creates motility, and it's required for adequate protein to not only be brought into the gut, but to actually be absorbed. So the immune cells are the first responders. They're going to tell the body that something is wrong, and they're the first ones to tell the body that. And it is the bacteria that sit in the gut area that educate that immune system, keep it vigilant, and tell us whether or not things are working well. So the GALT is a containment system. And together with these good bacteria, the commensal bacteria, these trillions of bacteria that sit in the gut, they prevent potential harmful intestinal antigens from getting into our systemic circulation. And that's what induces systemic tolerance. It allows the body to tolerate a lot of the stuff that comes in. And the two things that allow that to happen are IgA secretion, the secretion of the immunoglobulin A in the lumen and in the mucus layers of the gut, and the T cells, which are the beginning of the immune regulation. And I'm not going to discuss the secreted IgA in any great detail, except to tell you that it is the extremely important first line of defense. It protects the intestinal epithelium from various kinds of toxins and pathogens. So it basically is an immune excluder. It clears out the toxins and the pathogens by blocking their access to those receptors that are sitting on the surface of the gut cells, by entrapping them in the mucus and getting rid of them. And if it can't, that's when the problems begin. And so that leads us to the main issue of tonight, which is intestinal permeability and the microbiome. What is intestinal permeability? Well, it is the ability of moving stuff across the gut wall. And movement across that gut occurs in two ways. Through paracellular diffusion, that means diffusion between cells, and transcellular transport. That means the cell is able to take stuff into it and then put it out the other end of the cell. So normal intestinal function is quite interesting. Here is a schematic in which what you see is a typical cell, that a gut cell that has a whole series of antigens moving through it. And you'll notice that none of these larger circles are able to get into the area of the cells themselves. Only the little micromolecules are able to trans through the cell, but none of the macromolecules. So that's normal intestinal function. But what happens if you end up with leaky gut? What you begin to see is that you see these macromolecules beginning to move through because these cells are opening up in between. Something very strange is happening. You're getting these macromolecules moving in, but not only are they moving in, but the smaller molecules are beginning to attach themselves to a surface of the cell, which is now not able to move all of that away properly. So two things are going on. You're getting movement of macromolecules through the intercellular space. And if you look at this final picture, all of these little antigens, these are particles of food that cannot be moved away. And that begins to create a tremendous amount of IgA and IgG, immunoglobulin response. So there are a whole number of conditions which are associated with intestinal permeability. I'm not going to spend time going through all of them. I'm going to tell you only about the last one, which is that 50 or 100% of patients who have some kind of food sensitivity or chemical sensitivity will have a change in their intestinal permeability. And some of the treatment options which you're going to be thinking of are some endogenous protection that the body can create itself by creating more of the secretory IgA, which is more immunoglobulins that's going to block these antigens from getting into the body, and by creating more mucin. In other words, you want more of this mucoid stuff that's going to push the food along and not allow it to get in. And of course, exogenous protection, which Lucy is going to discuss, probiotics, quercetin, acetylglucosamine, and of course, L-glutamine, which is one of the major ways that supports the growth of cells. But what we're going to discuss is paracellular diffusion, because that is what intestinal permeability is really all about. Back in the 70s and right up into 2000, there were a number of Japanese studies that showed that in fact, the cells were not held together with brick and mortar, never to open, but in fact that there were dynamic openings between intestinal cells. And so they began to change the idea that the space between cells is impermeable, like bricks and mortar. Not at all. In fact, it is dynamic. And now we know that in fact, the paracellular tight junctions, as we call them, have a series of proteins, a whole series of proteins, claudins, occludin, zoes, JAMAs, a series of different actins, proteins, which together create a protein chain that are normally very tightly bound together and don't allow food to get through. But what we are beginning to find is that you can in fact dynamically open them. So once considered static, tight junctions are now considered as dynamic, and they adapt to the developmental, physiological, pathological, and various dietary circumstances which we have. And what do? They allow us to passively absorb nutrients. They are able to surveil or keep a close watch on the gut microbial content to make sure that it doesn't go out of whack. They defend against some of the infectious agents. And one of the most important things is that they'll be able to transport white blood cells, leukocytes, into the gut if needed. So what then is zonulin? Zonulin, otherwise known as zonula occludens toxin, was actually discovered by Alessio Fasano and his group in Maryland back in the early 2000s, and I really hope that he and his team win a Nobel Prize for the work that they've done. But it is an enterotoxin which is produced by the cholera bacteria, and we know that it regulates the intestinal tight junctions. In fact, what the cholera bacteria did is that what it was doing is it was enticing the body to open up its tight junctions, to basically push water from the body into the gut to get rid of that cholera bacteria. But as soon as those tight junctions opened, what in fact happened is the bacterium allowed antigens to move into the body. And that's where you'd begin to not only take in water, but lose even more. And as you know, cholera victims will die from dehydration. And we were able to find a correlate to that in the body on chromosome 16. We call it a prehaptoglobin 2. It is the human analog of zonulin, and it regulates the movement of fluids and large molecules and immune cells between body compartments. And it is on chromosome 16. So on that chromosome, you have the human analog to zonulin. And what is zonulin's physiological role? Well, it controls the opening of those paracellular tight junctions. It's a defensive mechanism. Its main function is to open and close dependent on the needs. One of the needs is to flush out microorganisms, pathogens that may get in. And so it contributes to the body's response to bacterial colonization of the small intestine. It is rapid, it is reversible. This is key. It's reversible and reproducible. So now we have a view of the gut as not being brick and mortar, but having a series of junctions that can open and close very quickly within minutes, depending on the needs of the body. Zonulin is the only physiological modulator of these inter or paracellular tight junctions, which have been described so far, that does two things. It helps control macromolecule movement from the gut into the body, and therefore it's able to modulate tolerance and immune response. What are we tolerating and what are we going to respond to in an immune way? So let's take a look at this. Here's a typical tight junction in this schematic of some cells. Everything is closed up, and along comes a fragment, some kind of antigen, into the lumen. And when it does that, without going into detail, these cells will produce zonulin. When the zonulin is produced, what it does is it has an effect on these tight junctions, and the effect is to just blow them open. And when it does, it allows the passage of antigens, which otherwise would never have gotten in. And when it does that, there is a massive antibody response, IgA and IgG. Remember that IgA is in the gut, the largest amount of immunoglobulins in the gut, but IgG is by far the largest amount of immunoglobulins that you will have from diet and nutrition. And one of the things which I do want to mention is that we now have found a way of being able to inactivate zonulin with something called larazotide, which we'll be discussing in just a few minutes. So this, what we call the leaky gut syndrome cycle, starts with a disruption of the gut lining due to stress, antibiotics, etc., which can cause improper absorption with the production of immunoglobulins, some food intolerances, also immunoglobulin response. All of these things will produce inflammation, which is due to, of course, the antibody and the food antigens creating all kinds of complexes in the gut. And what is the result of that? The result of that is a leaky gut, an inflammatory response which worsens with improper absorptions, creating even more of an IgG response. And let's remember that these leaky membranes are not just the gut, but the leaky brain, the blood-brain barrier, can also be affected, and that is extremely important of the immense effect on the mood and various neurological problems, and of course the skin as well. The other thing that we do need to remember is the gastrointestinal flora, the microbiome. We do know that the bacteria colonize all parts of the GI tract. One of the things that you're probably aware of is that at birth, we get bacterial colonization. And for those of you who would like to get some wonderful new studies, we can send it to you. And it shows the difference between babies that are born by vaginal delivery and those that are born by C-section. And as you're probably aware, those that are born by vaginal will have a much more commensal series of bacteria in which the mother's vaginal bacteria will impregnate the birth, whereas with C-section, it doesn't have that kind of bacterial colonization, but it really is much more like skin bacteria, which can be cause a big problem. Breastfeeding, tight junctions are more open in the first 3 months, and therefore it is really at that time that breastfeeding is most important. Not saying don't breastfeed after, but its greatest effect is in the first 3 months. Remember, greater than 100 trillion bacteria, 70% of the immune system lies in the GI tract, and 50% of colonic content in the colon, is in fact bacteria. And those bacteria have a tremendous effect and are affected by everything from age, diet, probiotics, of course, birth, maternal flora, antibiotics, extremely critical. For children who are given antibiotics in the first 2 years, the types of bacteria that they have in their gut after that changes critically. And so it's extremely important to remember that these children up until the age of 2, one should be very careful not to be giving them antibiotics indiscriminately. And this dysbiosis in the gut, this loss of the good bacteria, the commensals, is affected by the antibiotics, other drugs, chemicals, stress, extremely important, this low stomach acid that we talked about, and the various types of diet. So let's talk about diet and how it can promote leaky gut. I don't have to say any more, but by looking at this slide with the various types of fast foods, excess sugar, the amounts of gluten we take in, casein, processed foods, and alcohol, the standard American diet and alcohol has really significantly increased the risk of developing a permeability change, otherwise known as leaky gut. And what about food sensitivities then? We know that there are 3 categories of the diet-induced inflammation. Food allergies, which only really represent 4 or 6% of the population. Various autoimmune problems, again, a small percent of the population. The vast majority are really food sensitivities, which are non-allergic, non-IgE. They're really IgG, IgA. For example, non-celiac gluten sensitivity is 6 to 8 times the prevalence of real autoimmune systems like celiac disease. And it will stimulate both the innate and the adaptive immunity. So remember, it's food sensitivity that is the critical feature. And food sensitivity, we know in about 17% of the cases, we know what the cause is, be it IBS, etc., which you see on the list. The really important information is that 83% the cause is unknown. But we do suspect from many studies that it's really caused by dysbiosis. That is the change in the percentage of these residential commensal, otherwise known as good bacteria, and the change of percentage of that to the pathogenic or bad bacteria. In fact, if the good bacteria go below 85%, you can be assured that the problems are beginning. You're going to get virus, yeast, toxins, various kinds of undigested food, and you get them in excess on the gut lining and the receptors of the cells, and they begin to cause damage. So this is an important finding. Stress is an extremely important factor. In fact, if you increase stress, especially chronic stress, you get hypersecretion of cortisol by the adrenals. That will significantly change the digestion and absorption. It gets compromised. This increases the intestinal mucosal inflammation, which of course then increases more production of cortisol, and that will increase more stress. So that is the vicious cycle of what we call stress-induced leaky gut cycle. The hormonal imbalances, which is incredibly important. I'm going to leave some of that to Lucy, but please remember that the deficiencies of these 4 main hormones, the estrogens, testosterone, progesterone, and thyroid, let alone cortisol, will lead to intestinal permeability changes. And ladies and gentlemen, that is a very important issue, which Lucy will discuss in just a few moments. What I did want to focus on in the time remaining was on autoimmunity, because it is important to know that increased intestinal permeability plays a pathogenic role in various autoimmune diseases. In fact, the loss of intestinal barrier function is necessary to develop autoimmunity. It's absolutely necessary. The pathogenesis of inflammatory and autoimmune diseases have the conventional theory that goes something like this. If you've got a genetic predisposition of whatever it happens to be, let's say in the intestine, and if you have environmental issues, exposure to various types of antigens or bacteria, you put those together, those are the pathogenic factors that are common to inflammatory and autoimmune disease. And that has been the particular way in which we have seen the conventional theory. That is not what we now understand the new theory to be. And that new theory says you can have a genetic predisposition, you will have the environmental triggers, and that will be factors in creating inflammatory or autoimmune disease. But now you get the new stuff. The new stuff says in order to have that autoimmune disease, you need increased intestinal permeability. You absolutely need that. And you need the beginning of dysbiosis. That microbiome has to begin to go awry. And you need to then develop an immune response. And that, with all of these together, that will create autoimmune disease. So if you have genetic predisposition, are we able to change that? Not really, because your genetics is your genetics. Is it easy to change environmental triggers? As clinicians, we know not very easy to get people to change their way of doing things. But we can change their intestinal barrier function. And that is the important role of zonulin, which can modulate or even reverse the process of intestinal barrier function. And so when we go back to this chromosome 16 and we take a look at the diseases that are associated with zonulin, what we see is all kinds of diseases: inflammatory bowel disease like Crohn's, ulcerative colitis, celiac disease, diabetes, all, by the way, on this chromosome 16, multiple sclerosis, etc. So let's take a look at some of this. Inflammation. Well, we know that it underlies all degenerative conditions, including Alzheimer's, coronary artery disease, diabetes. In fact, the integrity of the gut lining plays a fundamental role in determining the degree of inflammation. And if you look at inflammation, the neutrophils, these white blood cells at about 80%, if you've got triggers and receptors for these white blood cells, you begin to activate them. And these blood cells begin to change. They flatten and then they swell and eventually they blow open and all kinds of proteins leave the cell. They're called cytokines. And as they leave the cell, they move into the circulation. And what do? They have immediate and delayed effects. They affect your gastrointestinal system, IBS, IBD, metabolic situations like diabetes, metabolic syndrome, obesity, the nervous system, migraines, chronic fatigue syndrome, of course, autoimmune such as rheumatoid arthritis, and of course, multiple sclerosis, big issue. Skin issues, eczema, psoriasis, and heart disease. Let's take a look at just a few of these autoimmune disease. Most important one, celiac. Gliadin and glutenin are the two proteins in celiac disease. And we know that if you look at the alpha-gliadin protein in gluten, here it is, and there are many studies that show that parts of this alpha-gliadin can have all kinds of effects. It can have cytotoxic effect, immunomodulatory activity, which I won't go into, kinds of receptors on certain gut cells. But what it can also do is liberate zonulin and therefore change intestinal permeability. That's a key function of alpha-gliadin. And so the body perceives alpha-gliadin, this molecule, in the same way that it perceives a pathogenic organism. And therefore it reacts in the same way. It wants to get rid of it. and it opens up those tight junctions. So if we look at our new theory, the genetic predisposition, you've got to be predisposed. So 95% of people with celiac disease have an HLA modulation. It's a particular type of receptor on their cells. The environmental trigger, the famous gluten. But what do we have? We need to have a dysbiosis. The microbiome has to change. And you need to get a leaky gut. That gut needs to open up, which it does because celiacs produce a tremendous amount of zonulin. In fact, there is a longer and greater, 5 times the amount of effect of leakage in the gut cells of celiacs. Celiacs, in fact, produce 30 times more zonulin than non-celiacs, and their intestinal permeability is three times greater than it is in normals. So gliadin activates the zonulin signaling, and that leads to increased intestinal permeability to those macromolecules, which should never be getting into our system, but they do with the celiacs. So the increased zonulin is gliadin and the overgrowth of bacteria, fungus, yeast, parasitic infections. So it's that overgrowth and gliadin which can cause the leaky gut. And once you remove gluten from the diet, the serum zonulin levels decrease. The intestine can come back to its baseline. In fact, the autoantibody titers, the amount of it that's there, actually normalizes, and the autoimmune process shuts off. So this intestinal damage, which was the biological outcome of this autoimmune response, can heal completely. Actually, quite remarkable. Inflammatory disease, inflammatory bowel disease, increased intestinal permeability, which is central to all pathogenesis like IBD. And in fact, we know that in asymptomatic Crohn's, the increased permeability can precede the relapse of Crohn's up to 1 year before that. So please remember then that in increased intestinal permeability is an early event in the exacerbation or making the disease worse. After that, all of those proteins which get released will maintain the problem. So what is the pathogenesis of these problems? There's a defect in the intestinal barrier caused by zonulin probably, and that increases the intestinal permeability. That therefore increases inflammation. And with the increased inflammation, all these cytokines, these proteins get pushed out into the system. And one of the things they do is they'll change the tight junctions and the way they operate. They'll open up, and that'll give you even more intestinal permeability. And that's the classic vicious cycle. Diabetes. Well, you need to know that people with type 1 diabetes have very high amounts of zonulin. As you can see, much higher amounts of zonulin than controls, and even their relatives have higher amounts of diabetes. So it's a large subgroup of these people with diabetes who experience zonulin-dependent increases. And when do they get it? They begin to show this prior to the disease onset. So these people are showing zonulin effects even before the disease is able to happen. Multiple sclerosis, please remember that different types of MS will show much more elevated amounts of zonulin. And when you remove the zonulin, they come back, as you see with number 3, the zonulin levels can be comparable to controls. So serum zonulin in multiple sclerosis is a way of being able to see whether or not they are able to suffer from this disease. There are other diseases which I won't discuss in detail, except to tell you that obesity is now being able to be shown to be part of a dysbiosis issue and an increased permeability. Autism, look at this. In 1975, it was an incidence of 1 in 5,000. By 2012, It's now 1 in 88. Something is going on. What is going on? Well, it's the same thing that's going on with an incidence of multiple sclerosis, Crohn's disease, diabetes, asthma. What is happening? And what seems to be happening, ladies and gentlemen, is that it is the kind of diets we have. It's our nutrition. It's the composition of the microbiome, especially in the first 2 years, which then leads to all the changes which I discussed in the last few minutes, which are independent of your gene predisposition. And no matter what else it is, that immune response will lead to all of these immune-mediated diseases. And so how then do you assess intestinal permeability? Well, a lot of people in the medical field will tell you that there are many ways to do it: barium swallows, endoscopy, colonoscopy, stool analysis, etc. But they're not very helpful when you're assessing or establishing the functional pathology. So what I wanted to do here as I end is to let you know what the complementary assessments are. So when you see your clients, the first thing that we really feel you should be looking at is what is the damage to the tight junctions. And the primary screening function should be, I say with all respect, should be to look at serum zonulin. And I've given you on the left side a usefulness rating on a rating of 1 to 5. And many studies now are showing that that really has a rating of 5. The second thing that you should be looking to do is looking at what is activating the immune response. And of course, the classic way is to look at immunoglobulin IgG food sensitivity, and that identifies the antigens causing inflammation. In fact, if you have greater than about 15% of IgG generating moderate or severe reaction, it correlates very, very well with what we call leaky gut. Again, a usefulness rating of 5. More of that, the general leakiness. I don't know how many of you have done lactose. They're very difficult to do well. It has been the predicate, the gold standard, although most people do not use it. What you really need to know is that it does have a usefulness rating of 5, even though it's not used very poor correlation with macromolecule permeability, but it has to be mentioned. What I am also giving you as a number 5 is looking at stress and its effect on permeability and absorption. The saliva hormone profiles are extremely important, especially the cortisol to DHA ratio, which tells you if you have an adrenal fatigue. With chronic fatigue, it'll affect the gut dramatically. Some of the others which are less important, damage to permeability, bacterial lipopolysaccharides or LPS. I don't know how many of you do that. It will show up in the blood in cases of permeability. It should never be in the blood. It should only be in the intestine. So we give it a usefulness rating of about 4. Some of you may be doing that. Nothing wrong with doing that. A comprehensive stool analysis also is worthwhile, of course, to look for bacteria and parasites, yeast, a 3-day cycle, and it measures the compounds that will produce inflammation, etc. And you look at the stool pH, as well as the presence of red blood cells, and of course, the inflammatory white blood cells. And we're giving it a usefulness rating of 4. There are allergic inflammation to decrease inflammatory response. Some of you may be aware of histamine and diamine oxidase. I'm not going to go into great detail on that. We're going to start offering that in our profile of tests this coming year. It has a usefulness rating of 3. It is very interesting as an overall look at allergic inflammation. And the last one, which I am mentioning to you, is does the person have a genetic risk of developing inflammatory disease? And there you need to look at the gene alleles. You look at a polymerase chain reaction test, which I'm not going to discuss, and that has a usefulness rating of 2. Other clinical presentations. And with that, with this whirlwind tour, Ben, I am going to now have you get to Lucy, who is going to go over some of the other modalities which you may want to look at.
Oh, so are you finished, Aaron?
I am finished, and Lucy is going to begin with her.
Okay. So let me
with her-
introduce Lucy. Thank you
Okay.
thank you very much, Aaron. That was amazing. That was a ton of information. So now, everyone, I'd like to introduce Lucy Blouin, who is a naturopathic doctor, and she's also among the first in Canada to be given the designation of certified practitioner by the Institute of Functional Medicine. Ms. Blouin has served as president of the Association de Naturopaths Agrès de Quebec, and she lectures frequently. I hope I didn't murder that too badly. She lectures frequently at both at home and abroad on various topics related to health and wellness. So welcome, Lucy. Question that was asked while you were speaking.
I don't know. Yeah, go ahead.
They were just curious about how the latent celiac disease, how you would know somebody had, like, how would you suspect celiac if they have latent celiac disease with no symptoms?
Well, one of the things that you need to remember is that if you're doing zonulin, can you hear me?
Yes.
Okay, if you're doing zonulin testing, the people who have latent celiac disease and some of the people who have sensitivities, non-gluten sensitivity, are going to show enhanced zonulin effect. So they're actually going to be showing much greater amounts of zonulin than those who do not have the celiac disease ability. And so you're going to see much greater amounts of zonulin in those people. And that's one of the things that we're hoping to discuss here in just a few moments, if we can.
Okay, so basically what I want to share with all of you, thank you first of all, Lorraine, to invite me, and Dr. Goncher. I will share what I have as an experience with zonulin in my office, and I'm going to give you all the tricks possible to be able to read a full test and what to do with it. So that's basically my goal today. So give you like the cookbook almost, huh? So basically, we'll go very fast on those because we went through the digestive tract absorption with Dr. Goncher already. But what I want to share, first of all, a lot of time as a naturopath or the nutritionist, what we hear is, oh, we have some allergies, we have some intolerance, and I have to remove this food, and I have to remove the other food. And finally, the person ends up, they don't eat hardly, and they're reacting on almost everything. So my goal today is to share to you, okay, what can we do? First of all, the problem comes from an inflammation in the gut, in the digestive tract. So the first step we want to do is to make sure the digestive tract is working properly, because when we have a leaky gut, what I see in my office is it's often coming from another issue. So it's not necessarily only the gut. So basically, the digestive tract, what we need to make sure is, we want to make sure that the stomach is functioning properly. So Dr. Goncher already talked about this slide. And if the chloric acid is not working properly, well, we're going to have a hard time with the protein to be absorbed properly. And often with people having vitamin B12 deficiency comes from a low HCl, iron deficiency, ferritin, and H. pylori infection comes from a very low chloric acid problem. And what we need to do is we need to re-enhance clinically this problem with supplements. I'm not a type of professional that will give supplements for the rest of the life of my clients or patients or whatever the name is, but it's basically to modulate the cell to function properly. So with the pepsins and the betaine and bromelain and the ginseng roots and the zinc, there are some supplements that's going to re-enhance the chlorogenic acid of the stomach, and from there, that's going to have an impact on the gut with the dysbiosis, inflammation problem. And how can we know if the person needs, if they have a stomach issue, example? So what I basically do, it's a zinc tally test. And basically, when you take a zinc tally and you put this in your mouth, normally what it happens is it's gonna be a very, very bad taste in the mouth. So if the taste is very bad, it means that the zinc is perfect in the body, so they're not deficient with the zinc. So in that case, I will give them the betaine, a supplement with betaine, and I will ask them, okay, take some betaine before you go, before you eat your meal. And if you don't have any, I would say, burning or heaviness in your stomach, that means it's the perfect supplement for you in order to re-enhance the problem that starts from the stomach. So often you're going to hear.
Excuse me,
about,
Lucy.
Yeah.
Are you moving the slides?
I know I'm moving now. Are you seeing now?
All we're seeing is the red zonulin first slide.
Oh no, really? Okay, so probably I will just.
Okay, now it's moving.
Okay, so if I do it like this, that's okay like this?
Yep, it's moving.
Okay, I'm very sorry
just
about
leave it
that.
like that. That's
Okay,
fine.
so the cause of basically chlorogenic acid problem, they will say age. I don't really believe in that, but because we modulate the digestive tract to whatever the age of people are. The stress will have an impact on the digestive tract. If somebody do a lot of fasting, it will have an impact. If there's an infection, like I said, the H. pylori, a lot of antacid abuse, or, well, like we said, Dr. Goncher, all the medications. So basically, in order to support this, we're going to use some supplements. It's freezing here. I'm very sorry about that. So basically, if you want to support the digestive tract in the stomach, I'm using the zinc tally, like I said prior, and I'm going to use some supplement with bromelain or betaine in order to make sure the digestive tract will function properly. I'm going to go a little bit further on. Is the gluten, there's a lot of discussion with the gluten, but in reality, there's two major protein that
I'm
that
sorry,
makes
Lucy. Okay, so there you go. You on the gluten stomach slide?
Yep.
Okay, good. All right.
So I want to make you understand that there's the gluten composition. There's two protein fractions that exist. You have the prolamine and you have the glutamine, and they are very, very difficult to digest. So that's one of the problems. So when somebody has an issue with the chlorogenic acid, we're starting to have a problem with the gluten. So what we need to do is to make sure there's enough chlorogenic acid and the digestive tract is doing properly. And what's going on with all the research happening and the pharmacological, I'm sorry about that, basically they're doing some research and they're trying to figure out which enzyme that's going to break down the gluten. And they're even talking about creating a vaccine for that. And they're even trying to create a type of medication to prevent the disease of celiac. So now the drug company are working hard to make sure, okay, what can we give as a medication or vaccine to make sure that the protein of the gluten is going to be digested in the stomach. But the joke of all this, the research, I'm going to go a bit faster here, is we've been in 2006, they start to do a new discovery. They say, hey, there's a prolyl endoprotease is found in a specific, I would say a mushroom. It's called Aspergillus niger. And that is a specific mushroom that is breaking down the gluten in the stomach. So it works when the pH is off, and if it's too much acid, it's resistant to digestion by the pepsin, and it degrades the gluten 60 times faster. And we have this in our foods, and we have this in a different kind of combination that I just give the slide here. All the combination that contains the digestive enzymes. and that is going to work as I would say optimal than the aspergillus in reality. So I give you here the slides of all the combination that you need to give to your clients in order to break down the gluten properly in the stomach. So you just Google and you're going to find the product that's going to be the same with the slides. And we have the other enzymes here. It's another combination that Dr. Lipsy, she's a nutritionist, very nice woman that basically shared all this knowledge to me and saying, well, Lucy, if you really want to work with gluten, you need to work with specific bacterial species and make sure that the stomach works properly. So you're going to have all this. You're going to have the chance to go through the slides and be able to refer to them. And the second, I would say, reflection I have with my client, if the stomach goes very well, I will start to ask myself question with the pancreatic enzymes. So if the stomach is not going well, we're gonna have a type of symptoms. The patient or client, they're gonna say, well, when I'm eating, Lucy, I feel that the food is sitting down in the stomach. So that means the chlorogenic acid is not working properly. Oh, I'm not able to finish my meals because I'm full very quickly. So that's another sign. When you have somebody that eats properly, example, they say, I'm not eating too much carbs, I'm doing okay with my food, but I don't know, Lucy, I feel like bloating. I'm like maybe 2 hours after my meal, I will say, okay, then this is a sign of pancreatic enzyme deficiency. That will give you some bloating. You're gonna start to have candida. You're gonna have like different stools. It's gonna be pale. It's gonna be large, and that will have an impact in a lot of molecules, and it's gonna have an impact on all the species in the gut to function properly. So the first thing you need to know is, okay, what's going on with my stomach? Is that okay? Okay, what's going on with my client with a pancreatic enzyme? Is that okay? So from going there, if that goes, everything goes okay, we're able to work with the amylase, I'm sorry about that, the pancreatic enzyme to re-enhance. I did a slide here that you be able to go through that. So I'm sorry if I go a bit fast because I want to make sure I'm going to get you guys going with the Zonulin test and how to read it. So I think you're able to read all those slides, what's going to increase the pancreatic enzymes. And afterwards, what happened is we're talking of the protein. My next reflex will go, hey, what's going on with the gallbladder? So that's my main 3 starter point before I start to work in the gut. I'm going to say, okay, what's going on with my stomach? I'm going to take all the symptoms. How am I going to take care of that? Is that a bloating situation she has or he has some problem with 2-3 hours digestive tract problem, bloating? So that's going to be basically related to the pancreas. And when you start to have fatty stools, well, that has a good sign with the gallbladder issues. So from there, I'm going to work with different plants that you're going to, and supplements with L-carnitine, that's just on the top here. And you're going to be able to re-enhance and modulate the gallbladder to function properly before you start to work in the gut. Because the problem is, if you don't have enough good fat in the gut, the mucosa won't function properly. And the good friendly bacterials, they are nourished by good fat. So the gut functions with water, good species, and good fat. If you don't have those 3 things in the gut, you will have a problem to try to re-enhance the tight junction and to make some supplements to kick in. So basically in the intestine, like the leaky gut, like Dr. Goncher just showed prior, we know that there's a stress, the toxicity exposures, there's infections, low chlorogenic acid, poor choice of diet, like we all know this. That's our first lane is what do you eat, how do you eat, and that is related to the leaky gut, and all those stressors will create some different imbalances biochemistry wise in the intestines. So basically, we're going to go through all this. We're going pretty fast again. But it's pretty funny to see that Dr. Mullen, he's a gastroenterologist from functional medicine, and he says, okay, what creates basically a leaky gut? Is it the food intolerance? Do I have a problem with the pancreatic? Do I have a problem with the gallbladder? So they're already starting, the doctors, to ask themselves what creates a leaky gut. So we don't aim only on the leaky gut or the junction. We have to go a little bit further up and see, okay, what's going on with my digestive tract? So we're going to see the stomach. I'm coming again. They say we have to say it 3 times before it goes in in somebody's head. After, I'm going to check what's going on with my pancreas. Is there a bloating issue? What's going on with my gallbladder? If she's breaking down or he's breaking down, emulsify properly the good fat. And from there, now I'm going to go see, okay, let's go see afterwards when the clients are gone, you change the diet, you give different enzymes. 2-3 weeks afterwards, they come back, and now you're able to work on the gut. And in the gut, we say the SIGA. So it's basically the SIGA that Dr. Goncher just talked about. And this has a major, major role for the mucosa. So the zonulin is the marker that's going to tell us the junctions are off. And the SIGA, if we don't take care of that, well, we won't be able to have a mucosa, and we won't be able to have good fat, and we won't be able to put some good friendly bacteria in the gut. Now they're starting to do more and more research on that. So if you have a problem with the secretory intestinal immunoglobulin A, that's going to create dysbiosis, SIBO. It's coming often from chronic stress, Crohn's disease, celiac disease. This is all linked to the SIGA. Now, how can we re-enhance and modulate that? We're going to modulate the SIGA with the vitamin A. So the vitamin A is the one that's going to enhance the marker, the protein of SIGA, and it's going to start to recreate your mucosa in your gut. So when you have your protocols, you need to make sure that the gallbladder is doing great, because the gallbladder is the one that's going to break down the vitamin A, because it's a liposoluble, you know? So the thing is, first thing I have to think again, I'm going to see, okay, is there a stomach issue? I'm going to do a zinc tally test. I'm going to see with maybe a little bit of betaine. And afterwards, if it's not an acid reflux, or the person tells me, no, I don't feel full when I eat after 30 seconds. Well, now I'm going to say, okay, are you bloating? Yes, I'm bloating. And I feel fatigue in the afternoon. So that I will start to give some pancreatic enzyme. Afterwards, if they say, no, I have fatty stools, I have pain on my right side, I'm going to start to think about the gallbladder. And after, when everything goes okay, and one issue or 2 issue or 3 issue, I'm going to start to think, okay, let's put the vitamin A inside of the body to make sure there's going to be enough mucosa before I start to work on the tight junctions. So it's pretty fun to see that the vitamin A increase the immune response, pathogen, increase the T cells at the same time, lymphatic. So the vitamin A is increased when there's a breastfeeding, like Dr. Goncher talked about, when you have a protein purified whey. The S. boulardii is going to increase the SIGA, the vitamin A, the glutamine, and there's different other issues that's going to, protocols, or I would say molecules, that's going to increase the SIGA and to function properly. So, and the ghee, what I love about that is it contains a specific triglyceride that will increase the SIGA. So Dr. Lipsy, she says to us in functional medicine, if you want to repair the gut, you need to take some ghee and add some probiotics inside. So the ghee has a big impact on the SIGA. So if we want to, after we did the SIGA, we're going to start to establish the junction of the gut. That will be my next protocol. And when this, and sorry about that. So this reestablishing of the junction, I will work with the L-glutamine. Everything is written down with the milligrams you need to give. L-arginine, L-glucine, the probiotics, vitamin D, omega-3 and 7, and the magnesium has an impact on the junction of the intestines. So you can consider at the same thing the NAC, the N-acetylcysteine, the L-carnitine, and the alpha-lipoic acid is to take in consideration in order to make sure that the junctions will be re-enhanced. So, like Dr. Goncher talked pretty well with all the importance of the gut, the good friendly bacterials and different types of species you can use to make sure that the small intestine function properly. You want to make sure that there's enough mucosa inside of the cells, and that's with the zonulin you will be able to, or you'll be able to see, do I have enough mucosa, or do I end up with the intestine that's starting to dry? So with the zonulin, that's exactly what you're going to be able to measure. So we're going to just skip all this. That's all my good species for different modification of flora. Everything is written down. I brought the amount of live species you need to have with all the different combination. And from there, we're going to start to work with different markers, like it's called for the immune system. It's the interleukin 17. There's more and more research that's coming towards that. So a lot of people will say, well, do I have a problem with my Th1 or my Th2? And now the local inflammation is, we're aiming more and more on the Th17 cell. So if we start to modulate that marker, we're going to have an impact on all the other interleukins. So we won't have any issues or thinking, oh, did I really assess interleukin 6? Did I really assess the other marker? If you start to modulate the Th17, you have the whole cascade that goes down and everything goes okay, and basically taking care of all the other guys that's under the Th17. And the way we want to modulate the Th17, well, believe it or not, it's so easy. It's with the vitamin D3 and the vitamin A. So if you give the vitamin A to your clients, you give the vitamin D, you're already working on the Th17 that's in charge of the whole inflammatory system in the gut. So we're starting to get the protocol easier and easier the way we're going further with the slides. Like, you know, the emollients are very important. Like, you know, we have the licorice roots, we have the slippery elms, and we have the marshmallow that reduce the intestinal inflammation. And you're going to be able to go through all the slides and to see exactly which supplement or which food can I give to bring down the inflammation. And like, you know, we have all those anti-inflammatories, those herbs that has properties anti-inflammatory. Like I say to all my clients, your kitchen is your pharmacy, so you don't have to go too far. So basically, the last impact, or the last, I would say, trigger that I want to really put in, I want you to focus in that, is basically the hormones, because we don't take care of this with a leaky gut. And the research that has been done in 2009 is the estrogen modulate the permeability and the function of the junction. So imagine all the women with the menopause and all the SPM and the men that creates way too much estrogen, or the environment that's way too much estrogen toxic actually in the environment. Like we know there's 94,000 molecules that just let go on them in the nature, and they say, oh, finally we're just left we left a dog a leash that's unbroken, and basically there's a bunch of estrogen toxic in the environment, and now we have men that has more and more issues with estrogen toxicity, and that will have an impact in the permeability and the tight junctions of the gut. Believe it or not, the progesterone is the one that creates the mucosa in your gut. So imagine if you're off with your progesterone, well, the gut mucosa will be off. Same thing with the testosterone. We'll have healing, um, healing, I would say,
A delay in intestinal healing.
that's it. I'm sorry about that. So the thyroid too has an impact with the leaky gut syndrome. So the stress, what happened? The stress will bring up your cortisol level, like what's happening with me actually now. And and now and it has an impact after when the cortisol goes high and inhibits the progesterone, the testosterone goes up, the estrogen goes up, and bang, now we have a leaky gut. Pretty amazing. I have a lot of Olympic athletes in my office, and I was wondering how in the clue they end up with a leaky gut. Now with the science, I understand that the hormones has a big impact. So let's go see the zonulin. Finally, we are there. So basically, the zonulin, you have to, you need to have, you have a marker, you need the markers between 5 and 25. That's the zonulin reference range, okay? And what I did basically, I did a ratio because we're in the prevention field. So if you go see the doctor or a conventional doctor, they're going to say, okay, you are 5 or you're between the 5 and 25 range. You're doing great with the zonulin, but you have your client sitting in front of you with a bunch of symptoms. So basically what I did with the experience since the last year, I'm working with the zonulin. Basically, I was participating of all Dr. Fasano literature in functional medicine. I know about zonulin. I would say it's already 6 to 7 years I know about this marker. And when Dr. Goncher arrived in my office, I almost faint because I said, oh, finally, I have a marker to work with because it wasn't existing before. So if we see this chart, this is a wrap up. That's exactly what you want to have in your office. So normally the reference range is between 5 and 25, okay? What we want to have as a number, it's 15. It's for sure you won't have a 15 100%. You're going to like, sometimes going to be 14, it's going to fluctuate 14, 15, 16, but you don't want to have this number going in the quartile low or quartile high. So if you have a number that's between 10 and 15, you have to go right down. You're going to see here, I think, well, we have it here. We're going to start to think about, oh, what's going on with my enzymes? This is you're starting to have slightly an inflammation of the gut. So there's inflammation issue. You can work with the foods, you can work with different supplements to reduce the inflammation. It's a starting issue. It's starting to go bad. When you're below 10, you're between 5 and 10. Now we have a problem with the SIGA. We have a problem with the enzyme. We need to work with the anti-inflammatory plants. We're starting to have a problem with the immune and cytokines. So we're going to think about the TH17, maybe some vitamin D, and starting to think, oh, what's going on with the cortisol level? What's going on with the hormones? So when you're quartile low, you're starting to be in an inflammation process. You're not losing it, but it's starting to be like, I would say, a dry gut. And this is not a diagnose, this is only observation, what I did in my office. When it starts to go in a high quartile, we're starting to have a chronic inflammation. We have problem with the enzymes, there's a dysbiosis, and there's a chronic hormonal problem starting at that stage between the 15 and 20. When we end up between 20 and 25, we're starting to have a problem with the junctions. So first thing I will do, I will start to work with the enzymes. I will start to see if they need vitamin A, work some plants and the nutrition to reduce inflammation. And afterwards, I will, after a few weeks, I will start to repair the junctions. You can't repair junctions if the enzymes are not doing their job properly. You can't repair a junction if you're not removing the inflammation. You need to go step by step. So when you're above 25, that's when you're starting to have a leaky gut, the junctions that are completely off. So now what we're reading is how can we work as a prevention field? Okay, so we got to give you an example. Here there's a test of zonulin, and basically on the square in the middle, I think if I put my cursor here, we have a number that's 4.7. So we know we have a client that's starting to have some issue, but they don't have the junction problem. We're starting to have a dry malabsorption of molecules in the gut. It's pretty funny when we see the numbers. A lot of clients, they will start to have a low quartile before it gets high. Sometimes we'll have some clients, it's going to be very low, and afterwards it's going at a high level, and when you're doing the zonulin test, well, you're just picking up like, oh, he's at 15, but he's doing great. So we need to go see what's going on with the IgG. Not to remove necessarily, yes, you can remove the foods, but to see what's going on with the digestive tract. So here, what's amazing, the way I'm using the IgG is basically to guide me, okay, where am I gonna start? Is it the enzymes of the pancreatic enzyme that's off? Is it the gallbladder? So basically, if we check this client, it started to be inflamed, and we have issues with dairy products, eggs. So now we're starting to think about the stomach. We're starting to have problem with the fruits. So this is a simple sugar. And now we're starting to have problem with the grains here. So now this brings me, we must have a problem here with the pancreatic enzymes. If I see here, we have nuts, this is protein and fat, that could be the gallbladder, and that could be eventually the stomach issues. So if we go and we check what's the highest, that's going to be a good guideline with which enzyme we're going to start to work with. Because like you know, pancreatic enzyme breaks down the protein, fat, and sugar. So with this client, because the fruits was high and the grains was high, I started to work with the pancreatic enzyme. And I think half of the problem the symptoms start to be reduced. After 2 weeks, the client came back and I started to work on the inflammation issue, because if you don't convert your fruits or your vegetables or your grain properly, what happens? It creates candida, it fermentates, it creates inflammation. So that's one of the reasons why this person started to be inflamed, plus the stress and so on and so on. Afterwards, I will give you I'm giving you just few cases very quickly to give you an idea. Like this woman of 62 years old, she has rheumatoid polyarthritis, and that was her, let me see here. So my question was, okay, do I give an elimination diet? What kind of diet? Do I have to change all the whole diet? So mostly of the clients, they know exactly what doesn't fit them in the foods. Okay, it's for sure we talk about nutrition, but when I ask my client to do a Zonulin test, believe it or not, because we say that junctions like all the arthritis, could be osteoporosis, scientifically wise, has a link with a leaky gut. And amazingly, that was the only thing she had was the cheese. That was completely off chart, but she has inflammation. So basically what I did, I started to ask questions. That's for sure the first session. They had some gallbladder issues in the family. I started to work with the gallbladder to make sure that she emulsify the good fat, because the vitamin A is a liposoluble. So if I want to make sure that my vitamin A is going to kick in, they won't be stuck with the vitamin A for the rest of their life. I have to make sure that the gallbladder is going to do the job. So I basically work on the gallbladder, and after I started to give back the vitamin A and give some probiotics, and everything went pretty well. Actually, 85% was all the symptom was reduced. So this woman with sinusitis, that was pretty funny, because again, we say, well, when you have some sinus problem, it is linked officially and scientifically wise with a leaky gut. So here she had a number 8. So she was like quartile low just for the third quartile. So it's not too bad. No, it's below the 10. I'm sorry about that. But look, all those issues. We have some dairy issues. We have some vegetables issue. Again, the grains was on the top. So basically what I did with this client, I started to work with, because she was complaining with acid reflux, I started to work with the stomach, and I started to give some pancreatic enzyme. And afterwards, I decided to, when that was pretty balanced, I started to give some slightly plants to reduce slightly the inflammation and try to figure out what's going on with her lifestyle, because she was on the go, 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 and go, go, go. So we did some hormonal issues afterwards to see if that was one of the concerns. This woman, Melissa, she's 35 years old and she has eczema. Again, I started to talk about the food. It's blocking here. Okay, I'm sorry about that. And look here, she has a 36. Now she has a leaky gut, a disaster state with the dairy products. We all know what we don't like the dairy products normally as a nutritionist. We don't like the milk or the dairy to the cheese and all this, but that has a major impact in her case, and it was linked to her gallbladder and her stomach. Why the gallbladder and the stomach? Because the meat was completely off. So that tells me, wow, something is off with the stomach, something is off with the good fat in the cheese. So I started to work on the gallbladder in her case and in the stomach to reduce all the inflammation. Check it out afterwards what happened. She had some issues with the grains and the nuts. So I had to modify her nutrition plan, that I remove all the triggers for a short period of time, that's for sure. I started to re-enhance the enzymes. I started to reintegrate the vitamin A, the vitamin D slightly. And after 10 days, we started to reintegrate some foods. And if she had some reaction, we removed it for a good 3 months to make sure that the whole cycle of the reaction will be reduced. So that's things that you'll be able to see. And at the end, when I balance the enzymes, I make sure that if the mucosa is doing great, the inflammation is off, I put some good friendly bacterials. After that, I will repair the gut with the L-glutamine in different composition that I showed you in the slide pretty fast. I'm sorry about that, but you're going to be able to rely on those slides afterwards and see all the protocols that I'm suggesting. Here we have a coach, Catherine. She's a coach. She has fatigue. She thinks she has a food intolerance, and basically she's complaining with the bloating issues. And when we did her test, she was at 4.4, and she had slightly problem with the grains, nothing big deal. So now I knew there was a link with her hormones. So basically we did her hormone test, and we saw here there's some issue with her estrogen values that will have slightly impact with the junctions, but it's not showed again with the zonulin. And we have problem with the progesterone here with her range. So that has a link on the mucosa lining, and she had a problem with the testosterone. So we had a problem with the healing. So now in her case, the cortisol level was completely off. She was doing okay in the morning, drawn down there during the day. That's why she had this fatigue, but the fatigue had an impact on all the hormonal cascade that had an impact in the gut. So basically in her case, it's her adrenaline that's starting, the cortisol that started to trigger everything else. But we didn't have any choice to repair the gut anyway, because the damage has been done. But it was very light, but she had big symptoms from the hormones. So if we recap, this slide is the one that you need to have. Maybe you could put it like in a plastic and you have it beside you, and that's going to tell you exactly what kind of which path you will start depending where the number is. What I want you to understand is, even if you're between the 5 and 25, doesn't mean there's nothing that's happening. So that's what's going on with a lot of professionals. They're waiting the number to be completely off. And now I give you all my knowledge and this, I would say, a little bit of experience of how to repair the gut and in all this, but I learned it for so many years, and now I'm able to validate it with an objective data, and that's with the Fluid IQ, with the Zonulin test, and it's so easy to work with that. And basically, I think Dr. Goncha will explain you slightly how everything works. I think that's going to be pretty much my end up situation. I'm very sorry I started. I got stressed a little bit with this issue of
The PowerPoint.
oh, the PowerPoint. I said, oh no, I can't believe I won't give all this knowledge to the, and all the, I would say, the cookbook, because that's what you need. You want to make sure you have all the tools possible, and probably you're going to experience a lot of nice things that eventually I'll be able to listen to your literature or to your talk in the future. So I hope that's going to be a good tools for you. And I will say, enjoy Zonulin, have fun, and for sure, make sure that all those people are happy, healthy, and they're going to come back in your office. Oh, it's a pleasure to be with them.
Okay, thank you very much.
So basically, the vitamin A, I'm going to use some halibut vegetables, vegetal, I'm sorry, and animals. It depends. So I will take some halibut oil, and if I take the vegetal, I use often the vegetal one, and it's going to be 10,000 UI, and it depends where my marker is going to be. If it's like slightly between 8 and I would say, yeah, that's it, between 10 and 15, I will go with 20,000 unity, and more it goes lower, I'm going to go up to 30,000 unity to up to 50,000 unity. And this is for a short period of time. I never gave vitamin A for a long period of time, meaning I take, I will suggest a 4-week treatment, and I will go with a whole questionnaire, and I have different tools to be able to validate if I need to continue another month or not. I never go over 3 months with a vitamin A, never.
Okay. What about, have you ever had the experience with somebody having cramping with HCl and enzymes, that it's caused them cramping? Have you ever come across that?
Yeah, so that when that happens is often there's an issue with the possibility of H. pylori. And there's an ulcer in the stomach, or rather there's a H. pylori infection, and the client doesn't know.
Okay, and just before we move off the vitamin A, Jess is asking about cod liver oil. Do you ever recommend that for the A and the D?
Definitely.
Okay. And what about when somebody, you talked about people having issues with their gallbladder, but what about when they have no gallbladder? What kind of deficiencies do you see there?
That's a very good question. Basically, the bile continues to be produced. It's not because they don't have a gallbladder that nothing happened. The bile, imagine it goes right down in the lining of the intestines. So you have to treat it like I treat it like a real gallbladder. What happened is those type of clients will have issues with their gut often because the bile is burning the whole lining of the intestine. So every season I would do, I'm suggesting my clients to have supplements that that will, I would say it's choline inositol I use a lot to make sure it smooth the intestine and reduce inflammation, because they're stuck. The bile is not going in the gallbladder anymore. It's just flowing there in the gut and creating dysbiosis and so on.
Okay, and then we have, sorry, I wrote all over this thing. So based on the reference to estrogen and progesterone, we had somebody asking about menopausal women and whether that means they automatically have leaky gut because they have lower estrogen levels or progesterone levels.
Okay, first of all, the hormones, you don't lose them in the sidewalk. Okay, that's number one. The thing is, when you're going through menopause or your menopause, you're not creating as much hormones because you're not creating babies anymore. So you have an amount of hormones to make sure to nourish all the tissues in the body. Okay? So the problem is it's us as women. We are in North America. We are in a go-getter situation. We don't stop. So we have many issues with the cortisol. So basically, it doesn't mean that the woman that goes through the menopause or the man with the andropause, because we don't talk often about men with the same problem, doesn't mean there's a leaky gut. But you're going to be pretty surprised to see they're starting to have some digestive issues because it's all a cascade situation. The same thing for the men. We have more and more men stressed, the testosterone goes down, and the estrogen toxic is increasing in the body. So that will have an impact on the gut. And mostly of the men will have bloating with abdominals, and this is a sign of hypochlorous acid very low.
Okay, so another question we had was, do you recommend pre and post zonulin tests? And if so, how often would you do the zonulin test after you've done the protocol? So
that's a very good question. Basically, in my experience, Dr. Gonchar could answer on that one, but in my experience, I use it, takes me about 2 months to be able to change the cell signaling. So I will do it after 2 months or 3 months. And I have clients, they want to do every 6 months, or I will have clients, they don't want to do it again because they felt great. The symptoms went down. So it depends. Maybe you could.
Yeah, I think Lucy and I have discussed this many, many times. One of the things that you will see some of the more experienced clinicians doing is they'll begin with a portrait of their patient with a zonulin, always with a food sensitivity test. I know Lucy likes to use either the 24 or the 88, which we offer. Sometimes she'll just do the 24 so that it gives you the major food groups, and she'll be able to get a quick portrait that way, or occasionally an 88. Sometimes in the middle of treatment, you will do just the zonulin if you feel that that is necessary. That would be maybe 3 months later. And we've determined that normally after about a 6-month period, if you're going to do it, do again a zonulin with the food sensitivity. But remember, you will know depending on the patient. You don't treat them all the same. So depending on the patient, you will determine whether or not you're going to do another zonulin with a 24 or 48 just to see where their immunoglobulin level lies at that particular point.
okay, and this question I think is also for you, Aaron. What kind of support do you provide when the test is done? So if they get the test done with their clients and maybe they have some issues understanding what it means, what kind of support do you provide?
Like most laboratories, what we will do for those of you who are familiar with that is that if they are registered with us and have become clients of the lab and they have been getting testing, we will offer, if they do call us or get in touch with us, through email, whatever it is, we will get in touch with them normally within either immediately if we happen to be available, or within a 24 to 48 hour period. We will go over with them the questions which they may have from the report which they've received. So they will have the report, and if for any reason, for example, you saw some of the reports that Lucy was showing, if they're not quite sure what those are, then we will go over those reports with them, and to the best of our ability, we'll be able to give them some comfort in understanding what that learning curve is to be able to get to understand how to read it.
Okay, we have a strange question. I don't even know if it's a question. It says, basically, Dulcie's asking that I guess she has a client who has a pancreatic head, but not a full pancreas. Have you ever come across that?
That's for me, yes.
I guess.
Yes.
Have you
Yes.
have you come across that?
Not a full pancreas.
Yeah, that's what it says.
Yeah. So what you do is basically she must suffer from bloating, I'm pretty sure. So if this is the case, is not an issue to work with the pancreatic enzymes, not at all. And even then, I would probably ask them to take it in a long period of time, if it's not every day, a pancreatic enzyme to help the whole gut situation and the pH to function. And it happened to me. I have this patient that unfortunately had how we call this stomach cancer, and they removed the stomach totally. And I never thought that could happen. It's I said, how in the cool you're gonna digest without a stomach? And I did. I said, okay, Lucy, go for it. And I give some chloric acid supplements, and that changed the whole scenario of his digestive tract. Even if he doesn't have the stomach, I said to my client, I'll take a chance. I never did that, but if you have burning or whatever in comfort, stop it. And basically, the whole dynamic of his digestive tract, it improved with his lean body mass, because I have some BIA, bioimpedance analysis, and I was able to monitor and to see what's going on with all his body composition. Amazing. So I would go with the enzymes, that definitely.
Okay, so then we have another question. It says, Lucy mentioned that athletes come into her office and have leaky gut. Is this related to exercise stress? So high cortisol as a result of hard exercise induced stress?
The high cortisol will inhibit the testosterone and the progesterone. So that will play a major role on the mucosa. And at the same time, to make sure that the athletes often they don't eat enough with what they expend as calories, so that will have a problem with the stomach. So they have a very high stress because they put the level so a high level because they need to win. And I see this, I would say at least 3 athletes on 5, definitely. And they have joint problems because of that.
That's very interesting. Now, we got a question about the cost of the test. I did email everyone the price list. It's in the email that I sent out today, but the basic Zonulin is $99. And then if you get the food sensitivity tests, there's 2 prices, for one for the 24 food sensitivities and one for the 88, and I don't have that handy. They have quite a lot of different test options there, so I would suggest you check out the price list. And then Bonnie's asking, how long does it take to get results?
For the hormones, it's a 5 to 7 business day turnaround after we get the actual sample, which comes in through UPS. You find the UPS bag in the kit. And for the Zonulin, that is sent through by envelope with a pre-addressed envelope and pre-stamped. And that's a 7 to 10 business day turnaround.
Okay, and then we have another question. Do you give HCl to a patient if they're still on the antacid pharmaceuticals or the protein pump inhibitors, or do you give them HCl?
Yes.
That's what I've always said.
But the problem is eventually, often, it's all time with, you have to make sure that the doctor, he's the one who's going to decide if the medication will be removed. But what I realize is they have some example, they're going to take the medication, they will still have some acid reflux. So I will give them the supplement and it stops the acid reflux. But after a while, what's going to happen is the acid reflux will come because there's somebody that's too much there. So normally the doctor will be able to know this, and they're the one who decides to remove the medication if needed.
Exactly. Yeah. Okay, Dena's asking, in what cases would you use the Zonulin test as a standalone, since it appears the combo food sensitivity tests flesh out the results?
That's a good question. You know, I have to tell you, as a roundabout, we were talking, we're in the middle of a study right now, believe it or not, with Dr. Fasano, who's now in Boston, heading the pediatric gastrointestinal team at Massachusetts General. And we're actually in the middle of a study in which we're looking at zonulin levels on those with autoimmune disease, where zonulin is one of the ways of being able to determine what level they're at in that autoimmune problem. That's where zonulin by itself has a very important role to play. But when you're dealing with gut problems, with inflammatory gut diseases, etc., there I think Lucy would agree that one should be looking at zonulin together with a test for the immunoglobulin marker, especially IgG, which is what we're offering. That's the reason, by the way, that we offer them together. We originally got into this part of the business because of zonulin, but realized very quickly that you needed to have the two coming together in order to get a much better portrait of what is really going on. So zonulin, as it applies to autoimmune disease, there it has its very great importance as a test, as a standalone test. But normally, if you want to get a portrait of an inflammatory gut problem, you should be doing it together with some kind of a food sensitivity test.
And when would you do the 24 versus the 88?
I'm going to let Lucy answer that because I know Lucy loves the 24, and I'm much more into the idea of the 88. But I think she's taught me that in most cases, if what you're looking for is a very quick portrait of where that person is in their ability to deal with the food antigens, the major food groups that you see in the 24 will, in many cases, and again, as a clinician, you need to decide, you know, what do they need? But in many cases, the 24 will do fine. Many of us, I say many of us, the people who do work with us as a lab, like to do the 88 because that gives them, as Lucy says, 98% of what they're going to really need to see in terms of those major foods. There's never enough. You know, there's some people who say they want to see 200 or 300 foods, but the truth of the matter is when you really look at it, it doesn't really get you. There's a loss as you get up into the hundreds. You're not really getting the bang for the buck, so to speak.
That makes sense. But I also think it's great that there's the option of the 24 because that's a little more cost effective too. So
very much. That's exactly why. That's exactly why we offer it.
Yeah.
By the way, we're going to be offering in the near future some of the microarray technology to be able to give you a few hundred foods. The danger with that, and I really felt I needed to tell people this, we decided to go with ELISA testing for IgG. For those of you who know, ELISA test 13 antigenic protein tests for all the hormones, IgG, and many other proteins. The reason for that is that it is extremely sensitive, it is specific, and it is reproducible, predictable in a lab. Because each one of the little wells, and you normally have 96 wells every time it goes into the instrument, you have the controls, but you have up to about 88 or 90 foods. And in ELISA, each food antigen lies in its own little well. And so you know that you're going to get a very precise idea of what that food antigen is doing. When you go to the microarray, which is what a lot of labs have done, what it gives you is the possibility of 200 or 300 foods, or even more. But the problem is, in the real world, there's always a negative side. The disadvantage to that is they're still using the same wells, but they're putting about 20 different antigens into little micro portions of each well. So just imagine that one of those 20 foods you're extremely sensitive to. And it's like a flashlight shining in your eyes and saying, hi, I'm here. And you can't see all the other foods because of the high intensity of that one flashlight light. So you've got to be careful if you go to the microarray technology, that you're getting the right technology. There are some new ones that we've been looking at, which are really flashlight effects. But a lot of the labs that are using microarray are having that problem. That's the dirty secret in the closet. So you've got to be careful. Believe me, choose what you'd like. But we're very happy to say that with the ELISA technique and with the 88 wells, we're able to get very succinct, predictable, precise values on the IgG. And I think, you know, the reason why IgG testing some bad reports is simply because quite often when you're looking at hundreds of foods, you're really not getting very accurate values. And that's a problem. It's a problem. So we've stayed away from that problem. And when we go to the microarray, it's going to be the newest technology, which has just started to come on stream. And we're hoping to do that by the end of the year. We'll let you know.
Okay, great. I've got 3 more questions here. So one is, if somebody has, I never know how to pronounce this, Sjogren's. It's a Sjogren's. Yeah, yeah. Yeah.
That was the name of the doctor.
Okay, so is the zonulin test able to detect how far she is in the progression of that autoimmune condition?
The short answer to that is no. Sjogren's, as you know, even though it has systemic effects, for the most part, localizes itself to the saliva glands, to the glands of the eyes, and to vaginal areas, because the mucosa is very similar. The intestinal mucosa, even though you can say most mucosa is the same, does not give you the same type of effect. So I would say to you, the short answer is no. The longer answer is there aren't enough studies to tell us whether the no is really true. In other words, we would need to see some very good, well-done double-blind studies to see whether those with Sjogren's are really beginning to show enough dryness, as Lucy said, of the gut layer and a change in the microvilli. In other words, the brush borders begin to dry off, whether or not that really has an effect. But be careful. You can have a dry gut level, but the tight junctions haven't opened up. So one needs to be very careful. We just don't know enough of its systemic effect. We know a lot about its local effect. We don't know enough about its systemic effect.
Okay, Amy wants to know if her dog, or you can use the zonulin test for canines.
That's a wonderful question. There actually have been, there are now some studies that are beginning to take place. I think there's one out of Texas, and we were talking to some people about doing some tests, and I'll tell you why. Because we have an animal division of our company in which we deal with genetic changes in gum disease in dogs. And we have been asked whether or not we would want to be involved in some zonulin testing studies for dogs. We're not there yet. There are no specific studies that have been done. I would suspect that dogs will be showing similar effects. The real question is, what is their range of zonulin values? And we don't know if that's the same. Is everybody following? In other words,
Yeah.
Is it 5 to 25? We don't know that yet. I suspect it probably is, but we're not there yet. Ask me that question in a year, and we may be able to answer it for you.
Okay, and Dana wants to, can Lucy summarize the clues that the 24 IgG food categories provide? For example, that if there's high grain sensitivity, then there's pancreatic insufficiency. Is that basically what it means?
That's how I use it. So basically with the grains in the fruits and vegetables, I will think about the pancreatic enzymes. When it's the dairy products, I will think about mostly when the dairy products with the meat are high, it's definitely it's the stomach. When it's only the dairy products, I will suspect the stomach and the gallbladder. And when it's the nut, often I will think gallbladder first and after stomach, depending the symptoms they have, I will be able to go down the cascade. Yeah. That's basically why I'm using the 24 and the 88. I will use it when there's a lot of inflammation, like you saw the woman with eczema. So basically when there's a lot of eruption or a lot of inflammation and they have a hard time to move, I will go with 88. But mostly I go with the 24 to be able to know which enzyme I will start and what's the number.
Okay, that's good to know. Marina's asking, I'm not sure if this is applicable, but their hormone tests listed, I'm assuming that's the ones in your form, are they an option for us to utilize? I think maybe they don't know that there's saliva tests, so yes, that we can use those. And then it says, how about the Cal screen tests? Were they discussed? What are those tests used for?
Yeah, that wasn't for today's topic, but the Cal screen and Cal detect, I would actually stay with the Cal detect. We're very excited about that. For those of you who are aware of calprotectin is a protein that you pick up in the gut when you're doing a stool test, because it is a very sensitive measure of inflammatory disease of the gut. So for example, if you have Crohn's or ulcerative colitis, as an example, that is frank inflammatory disease, as opposed to IBS, which is not an inflammatory problem. It's a functional issue, but it is not an inflammatory problem. And so GI people have been using calprotectin as a way of determining whether or not it's inflammatory IBS or IBD. But what they needed to do is to take the stool and then send it out to a lab. And about 3 weeks later, they'd get a result back. Well, the Cal Detect is the first point of care test for calprotectin. And we're actually very excited about that, because that means that in your office, the patient who still needs to get a little bit of stool, but what they do is they come back to your office and it looks like a pregnancy test. You basically take the stool, which is now in liquid form because you put it into a buffer, and you just drop it 3 drops onto a little window. And just like with a pregnancy test, after a few minutes, you see some lines that may be changing in a window. And if the first line changes, it means that there is 50 micrograms per gram of calprotectin. So that says, aha, there's probably an inflammatory problem. But if the second line illuminates, that means there's 200 micrograms per gram. And then you know that you absolutely are certain that you have an inflammatory problem. And that is a point of care test right in your office. But it gets even better because they produced an app for iPhones or Android. And you can take a picture of that little window that has those lines. And a few moments later, because of some algorithms in the lab, it sends back a signal. And on the screen of your iPhone or your Android, it actually gives you a value. It says 348 micrograms. So it actually tells you the absolute level of calprotectin, which is exactly what you would get back as a report from a lab after 3 weeks. So it's a new world of what's called lateral flow cytometry. Most lab testing in the future will be going that way. And today we're the first lab in North America that actually offers that point of care test. But it wasn't for today's discussion, so we did not bring it up. But we're very happy to sell that. That's a product. That is not a lab service because it never gets to our lab. You do it right in your office. So you actually buy the product, and you can do it on your patients, on your clients.
Okay. This will be the last one. Where is Lucy practicing? And can we get the posters she was showing from her? I don't know what that means. I don't know if that's...
I'm going to answer by saying that, first of all, Lucy practices in Montreal, where we both are right now. And it may snow again, but right now it's been warm. And the poster she was talking about was really one of these slides, and you see it on the PDFs. It's the last PDF that actually has a picture of a gut wall, and then it has a series of little boxes with different descriptions of what you may want to think of. That's what we call the poster. And she was saying you'd want to laminate it, shmaminate it, do whatever you want with it, keep it in the inside drawer or whatever it is, because that tells you the various ways in which you can approach the types of nutritional supplemental treatment that you want to give, dependent on what you see on our report of zonulin and food sensitivity.
Okay, great. And we've had we've had several requests for both Lucy's email to be sent out and Aaron's email to be sent out. So I'm just confirming you have no problem with that if they have any further questions. Well, I guarantee you won't get a ton, don't worry. You won't be flooded with questions.
What I'd like you to do is just direct it through us, because the way the lab works is like most labs, and that is that if you want us to be able to speak to you, it needs to come through a common source. Okay. And so you would call us, and then we'll do triage. In other words, there's certain things we can answer most of the time, and if there is a need for our various clinicians as consultants, then of course we will be very happy to do that. But I would like to mention, because we are Fluids IQ in Toronto, as you said, Lorraine, but what they can do is they can call us or email us, and if they'd like to register with us as a client, then and only then we would then send out the kits to them, and they can also, of course, ask us questions and so on. But we would like them, of course, to be our client first.
Yeah, we did have, I was answering those questions while you guys were speaking, so they know they can order the kit.
Yeah, as soon as they become a registered member of our lab, then they can order as many kits as they want. They're free of charge, and all of that is free of charge until they actually do the test, meaning that we actually get a specimen, a sample in our lab, and that's when they get charged, not before.
Wonderful.
They can order our saliva hormones. They can order our blood spot. So, by the way, they are blood spot zonulins. So there's no IV. It's all very easy for the client to do in their own home if they want, or if they want to do it in your office, you can help them. And saliva, same thing. They can do it at home and just send it right through to us directly.
Wonderful. Okay, so everybody's saying thank you. Great webinar. I don't know if you can see the comments there in the chat. So they are very appreciative with the information. A lot of great information you shared with us tonight. It was really excellent. I'm sure we all learned a lot. And sorry, there's just somebody asking if there's a cost to register as a client. No, everything is free until you pay for a test. And you don't even pay for that till you get the results. So everything is good.
Exactly.
Okay. All right. So thank you. This was great. You guys did an amazing job. Anyway, okay, so I'm going to send out the contact information to Fluids IQ tomorrow, along with obviously the replay. I'll resend all the information and make sure everybody got everything. And thank you very, very much.
Thank you. All the best.
All right, good night.
Good night.